The average person waits 11 years from the onset of a mental health disorder to receiving treatment. When they finally do seek help, the evidence shows that two approaches work better than most: cognitive behavioral therapy and, for some conditions, medication. The question is no longer whether therapy works, it is which therapy, for whom. Psychotherapy refers to any psychological treatment delivered through a relationship between a trained therapist and a client. Modern psychotherapy has moved toward evidence-based practice, testing specific treatments against specific disorders in controlled trials, replacing the historical dominance of theory-based schools of thought. Cognitive behavioral therapy combines cognitive therapy's focus on distorted thinking with behavior therapy's emphasis on changing problematic behaviors. It is structured, goal-oriented, and typically brief, 12 to 20 sessions. CBT is the most extensively researched form of psychotherapy and has the strongest evidence base across the widest range of disorders. Cognitive restructuring teaches clients to identify automatic thoughts, the rapid, habitual cognitions that arise in response to situations, and evaluate them as a scientist would evaluate evidence. Clients learn to recognize cognitive distortions like catastrophizing and black-and-white thinking, then generate more balanced alternative thoughts. Behavioral activation targets the withdrawal and inactivity that maintain depression. By scheduling pleasant and meaningful activities, even before mood improves, clients break the cycle in which low mood leads to inactivity, which deepens low mood. Behavioral activation alone is as effective as full CBT for many depressed patients. Meta-analyses confirm that CBT is effective for major depression, generalized anxiety, panic disorder, social anxiety, PTSD, OCD, eating disorders, insomnia, and substance use disorders. Effect sizes are moderate to large. Unlike medication, CBT effects persist after treatment ends because clients learn transferable skills. Joseph Wolpe developed systematic desensitization to treat phobias by combining relaxation training with a graduated exposure hierarchy. Clients learn deep muscle relaxation, then imagine increasingly feared scenarios while maintaining relaxation. The conditioned fear response is replaced through counter-conditioning by an incompatible relaxation response. For OCD, exposure with response prevention is the most effective psychological treatment. Clients deliberately confront obsession-triggering situations and then resist performing compulsive rituals. The anxiety rises, then naturally subsides without the compulsion. Repeated sessions teach the brain that obsessions can be tolerated without compulsions. Trauma-focused CBT and EMDR, eye movement desensitization and reprocessing, are both evidence-based treatments for PTSD. Both involve processing traumatic memories in a structured therapeutic context. Controversy surrounds whether EMDR's eye movements add anything to standard exposure or whether the exposure component alone drives improvement. Mary Lee Smith's landmark meta-analysis of psychotherapy research found that the average therapy client performs better than 80% of untreated controls. Psychotherapy works. The debate shifted to which therapy works best for which condition, and whether specific techniques or common factors like the therapeutic alliance drive improvement. Across therapy types, the quality of the therapeutic relationship, the alliance between therapist and client, is one of the strongest predictors of outcome. Some researchers argue that common factors, empathy, hope, a coherent rationale, a healing relationship, account for more of therapy's effectiveness than specific techniques. For many disorders, combining psychotherapy with medication produces outcomes superior to either treatment alone. Medication can reduce acute symptoms rapidly, making therapy possible. Therapy builds skills and changes the underlying patterns that maintain disorder. After combined treatment ends, relapse rates are lower than for medication alone.